What's up, guys? How's it going? Cade Moore with More Muscle, and today we're going to be talking about something called appendicitis. Guys, the appendix is basically a part of your colon that's in the right lower quadrant of your belly, and it's basically a little small part of your colon. And what happens is there's a lumen that basically gets blocked, and potential bacteria stay in there, and you can even have a rupture of this appendix, and that can be very harmful because that's going to leave a bunch of bacteria in your stomach. So how would we deal with this appendicitis, right? Well, I've had three of my brothers have had their appendix removed, and two of my close friends have gotten their appendix removed, and what they explained it was they had a lot of pain, and then after it had burst, after the appendix had ruptured, their pain went away, but that's still very dangerous because all that bacteria and infectious material is in your stomach, and that can cause a lot of harm, and it can even cause death. So if you have that pain in your right lower quadrant, that is a possibility of appendicitis, right? So let's go ahead and get into it. So guys, appendix, right? The average client is about 10 years of age. There's inflammation to the appendix, and obviously, like I said, caused from an obstruction of the lumen of the appendix. So basically, there's an obstruction, and there's bacteria that gets trapped in there, and it's going to cause you a lot of pain. So expected findings, guys: you got abdominal pain in the right lower quadrant, rigid abdomen. So you'll see your abdomen; it's not going to look normal. It's going to be rigid. Decreased or absent bowel sounds. So when you have the stethoscope and you listen to their bowels, you're not going to be able to hear the normal sounds. Fever, diarrhea, constipation, lethargy, tachycardia, rapid shallow breathing, anorexia, possible vomiting. You want to get some tests, some CBC tests, current blood cells, and a urinalysis. And you can also do like a CT scan to check to see if this appendix is enlarged. You want to avoid applying heat to the abdomen. You want to avoid enemas or laxatives. You want to prepare the family for surgery using developmental, appropriate techniques. So, if, for example, if a 5-year-old, has is going to get their appendix removed, you're going to have to explain it to them where they can understand it, But if you're a 10-year-old, they have a little bit more knowledge. So you got to explain it explain it to them at what level they are developmentally. All right. And then next thing, guys, it's going to be a laparoscopic surgery. So you're going to remove that. They're going to be on some IV replacement fluid therapy and some antibiotics. Antibiotics are going to kill that bacteria. And obviously, you want to maintain their airway, provide supplemental oxygen if needed, obtain vital signs, pain medications. You want to assess their bowel sounds and stuff. And now let's talk about some preoperative nursing actions. So you want the electrolyte and fluid replacement NG tube for decompression, and you want to administer IV antibiotics. Then post-operative, you want to make sure their vitals are okay. You want to give them pain medication. You want to maintain the MPO, right? So you're not supposed to eat for a little while. And then you want to maintain the NG tube, provide irrigation for the care. You want to make sure their wounds healing correctly, and you want to assess for a fever, guys. A fever indicates an infection. And so if your temperature is high and you just had an appendix out, that's a pretty big, serious problem, because that can be harmful. Because right after surgery, getting infection is very bad. Anyways, guys, you're gonna want to assess for any abdominal pain, rigid abdomen, rapid shallow breathing, pallor and chills, and you want to basically look for peritonitis, guys. So that's inflammation of the peritoneal cavity. You want to provide pain management, administer IV antibiotics for infection, manage NG tube suctioning, and you want to basically just keep them NPO. And then basically, guys, after you've had that appendix removed, the appendectomy, whatever it's called, you want to rest. It's recommended for about 14 days. 10 to 14 days you want it to rest. To let that heal before, it gets worse. But guys, remember, this can actually be very serious. If you do have pain in your right lower abdomen for about 3 days, and then all of a sudden that pain goes away, that indicates a rupture of the appendix. So anyways, guys, thanks for watching. Hopefully you learned something about the appendix. Hopefully it doesn't happen to you. Thanks.